Hi everybody. So this class today we are discussing on a new topic, that is targeted drug delivery system. So here we will discuss on the concept of targeted drug delivery. What is targeted drug delivery? Why there is a requirement of targeted drug delivery, and what are the types of targeted drug delivery? What are the carriers? So these are the some of the points what we are going to discuss in this class. First of all, what is a targeted drug delivery system? In short, a targeted drug delivery systems are smart delivery systems. Smart delivery systems which could able to deliver the drug molecule in a particular site specifically it could take. You assume the normal tablet or capsule, that's what we are administering, irrespective of the route, either oral or IV or whatever route might be. It distributes throughout the body, it distributes various parts of the body, and this distribution is depends on the factors related to the drug, factors related to the body barriers, perfusion rate, etc. So even though if it is not an equal distribution also, it will be distributed in all the parts of the body, right? That means it distributes into the normal cells, it reaches into the affected cell, it may taken up by the targeted cell, it may taken up by the non-targeted cells. So it is distributed everywhere. But what is the ideology or concept behind the targeted drug delivery system? It is targeting. As the word clearly indicates, it is targeting. Which cell we want to target, which is the site of action, which is the target cell. So in the particular target, this delivery system could able to carry the drug molecule. If you are administering the drug as orally, or if you are administering the drug as an IV route also, whatever it might be, whichever route it might be, the carrier, so we are administering the drug with the help of a carrier. So the drug developed with the help of this type of carriers to target the cells, that we call it as the targeted drug delivery system. So these carriers take your or carry your drug molecules into its targeted site. So that is the very short, we call it as the targeted drug delivery system. Now, why there is a need of the targeted drug delivery system? So it helps in this targeted drug delivery system helps in the effective localization of the drug moiety in the target, and to produce the therapeutic concentration and restricting its access to the non-targeted normal cells, and minimizing the toxic effect and maximizing the therapeutic effect. Okay, listen. So as we know, the drugs were free, whatever the drug what we are administering will have some impact on the cells, some impact in our body. One impact, it produces a therapeutic activity. Second impact may not be severe also, it may produce some side effects. The side effects may not be severe, but some effects it will be producing. It produces some impact on our cells, so in our body. Now, suppose for a particular disease, there is a reason for producing the particular disease in our body. So for curing this disease, we need to administer the drug only to the particular site or particular target who is causing the disease. No need to carry the drug into the entire body. So this targeted drug delivery system helps in localization. So which is the target of the cell, which is the target of this disease, this carrier or this delivery system helps to localizes the drug molecule near to the particular target. It directly localizes the drug molecule into the environment of the target cells. So this delivery system will increases the therapeutic concentration of the drug in this particular environment. Which environment? In the environment of the target cell. So at this environment, it increases the therapeutic concentration and it will reduces the concentration of the drug in other peripheral parts of the body. It reduces the concentration of drug in the normal cells and it increases the concentration of the drug in the target cells. So that what is the advantage? The non-targeted cells amount will be reduced, the amount of drug in non-target cells gets reduced, the less side effects gets reduced, non-toxic effect may be causing, and the therapeutic effect will be higher. The reason for the higher therapeutic effect is what? Higher concentration of the drug is reached into the target site. And what is the reason for less side effects or minimum toxic effect? That means only a minimum amount of drug is reaching into the non-targeted cells. So because based on this criteria, based on these conditions, the targeted drug delivery system becomes an emerging thing. Now, how it works? How this targeted drug delivery system works? It basically bypasses the first pass metabolism. There are so many methods it works. One of the method is it can bypasses the first pass metabolism and it can reaches the receptor. As we know, the first pass metabolism by the gut walls, by the hepatic liver cells. These are the hepatic cells. These are some of the basic mechanism, or first pass metabolism is a basic thing for each and every drug molecules. Depends upon the specification of the drug as well as the type of enzymes present in the liver. So some drug may be extensively bypassed or metabolized, some will be very less metabolized. So this targeted drug delivery system, the main advantage, the first advantage it offers is it can bypasses the first pass metabolism. Now, what are the characteristics of an ideal targeted drug delivery system? It should be inert, that is, it should be non-toxic, non-immunogenic. It should be stable in vivo and in vitro conditions, and it should have a restricted drug distribution. That means it should distribute only to the target and it should not distribute to the normal cells. Then controllable and predictable rate. Once it reached into the target site, in the target site also, it should release the drug at a particular controlled rate. It should not release the drug in a fast way. It should not release the drug in a very slow way also. That means we could able to predict the rate of drug release from the delivery device. Then it should able to release the therapeutic amount. Once the rate is controlled, that time also it should able to releases the therapeutic concentration. Then should have minimal drug leakage. The leakage of the drug molecule should not happen unnecessarily. Then it should be biodegradable and it should be easy to manufacture and it should be reproducible. At any point of time when we develop this type of drug delivery system, the results should be reproducible. So these are the characteristics. Now, what is a drug carrier? This is a common term which we are discussing so far because the delivery targeting is happened with the help of a carrier. So carriers are the transportation of the loaded drug molecule. So these are the entire part, or this is one of the main part of the targeted drug delivery system, or these are the vectors that transports and retains the drugs and aims to deliver in its targets. What are the characteristics of a carrier? That is, it should cross the blood-brain barrier if the target is within the brain. If the target is in the brain, it should be able to cross the blood-brain barrier. It must recognize the target cell. This carrier should be able to recognize the target cell. It should be stable in the plasma. It should be non-toxic, non-immunogenic and biodegradable. It should release the drug moiety inside the target cells. So these are some of the characteristics of the carrier system. Now, what are the different types of drug carrier? So this drug carriers can be in a different way, that is liposome, monoclonal antibodies, plasma proteins, soluble polymers, lipoproteins, microspheres, nanoparticles, polymer micelles, and cellular carriers. Now, the selection and type of drug carriers depends on, so which type of carrier should be selected for a particular drug molecule. That is depends upon the type of the drug or the physiochemical property of the drug molecule and the targeted area to which the drug action is desired and the type of the disease. So it's mainly depends upon the nature of the drug molecule and to which area we should target and what is the type of disease. So based upon these conditions we should be able to select the particular carriers. Now, what are the various approaches? What are the various approaches for targeting the drug molecule? There are two basic approaches, that is the passive targeting and second one is the active targeting. Let us see what is passive targeting. So passive targeting is a normal procedure that is happening in our body, that is present naturally in our body. For example, hormones, neurotransmitters, these have the natural tendency to go and target the receptors at their site of action. So these endogenous substances or these hormones has the inbuilt or the natural tendency to bind with its targets. So it's not been monitored by an external carrier. It's not been monitored by an external facility. It itself finds its target and binds with the target. So an example of this, insulin is binds with its insulin receptors. The direct drug injection or catheterization are examples of passive drug targeting. Passive targeting is also known as a physical targeting. Suppose if you want to administer the drug into a ocular cavity, you are directly administering into the ocular cavity. You are not directing through the injection or not something. So we are administering the drug molecules directly into the site of action by the physical methods. This we classified under the passive targeting. How the carriers helps to target the cells? This we'll see in the last part of it. Now, what are the passive targeting schemes? The passive targeting schemes are of three types. In the first step, study about the physiological conditions of the diseased area. Study about the physiological conditions about the diseased area. Because the diseased area physiological conditions will be absolutely different from the healthy cells. So we should be able to understand what difference a diseased cells makes from a normal cells. So this is the first step in the passive targeting. Second step, preparation of a delivery carrier having a definite molecular weight and a molecular size and possessing hydrophilicity and a neutral charge. So the second step is development of the carrier based on its certain physicochemical parameters like molecular size, molecular weight, hydrophilicity, and the neutral charge. The third step is adjusting the delivery system to be sensitive to pH, temperature change, or the enzyme. The coating of the carrier is designed such that during circulation in the blood, it is stable, but when entering the capillaries in the tumor, this is especially in the case of tumor targeting, where the temperature is slightly higher, the coating melts and discharges the drug which accumulates in the tumor, starting its action. Such a carrier is said to be thermosensitive. So the third step is being explained with the help of an example. That's in the first step, it was identifying the physiological change of an affected cell. So based upon that study, it is identified that, as an example, if you want to target a cell to the tumor cells are having little bit higher temperature than that of the normal body cell. So what we have to do in the third step, the carriers must be selected, and it should be coated with a thermosensitive polymers so that it should remain in the normal capillaries, but once it reached into the tumor cells, because of the higher temperature of the tumor cells, the coat over the carriers starts melt, but this coat is stable in the normal temperature of our body. It is stable in the normal capillary cells. So based upon this temperature, this coat dissolves and its carrier releases the drug molecule within the tumor. So what is actually happening? Even though after administering, the drug delivery system is circulating throughout the body, it is thermosensitive and it is releasing the drug only in the tumor cells. So that's on the passive targeting. Next one is active targeting. What is active targeting? In an active drug targeting, the molecules like antibody or antibody fragments, peptides are coupled to the drug, and the delivery systems act as the homing devices for strapping to receptor structures expressed at the target site. So in case of the active targeting, what happens? We see the passive targeting is a targeting method which usually happens in our body, that can be developed with the help of certain carriers by adjusting the physicochemical properties of the carriers. Now, what is active targeting? In case of active targeting, the targeting with the help of certain antibody or antibody fragments, peptides. So the drug can be coupled with these things. The drug can be coupled with these antibodies and it can be developed. So the drug targeting by ultrasonic energy and magnetic field is also considered as the active targeting. So these are some of the other types of targeting, targeting method by using ultrasonic methods or by magnetic drug delivery systems. This active targeting approach are of three different types. Okay, that is first order targeting, second order targeting, and third order targeting. What is meant by first order targeting? So this refers to the restricted distribution of the drug carrier system to the capillary bed of a predetermined target site, organ or tissue, which includes compartmental targeting in the lymphatics, periodontal cavities, pleural cavity, cerebral ventricles. So this restricts the targeting only into the distribution of drug into the carrier in the capillary bed. So up to the capillaries it targets. Once it enters to the second order targeting, what happens? It refers to the selected delivery of the drug into the specific cell, especially tumor cells. So, and not to the normal cells. So in the first order targeting, the drug is targeting only up to the capillaries. In the second order targeting, it is targeting from the capillaries into the tumor cells. The third order targeting, this delivery specifies to the intracellular site of the target cells. So in the second order, it was only towards the cell, but in the third order targeting, this carries the drug molecule into the intracellular site of the cells. Okay, so that is the different methods of active targeting. Now let us see how the carriers helps to target the cells. The drug and the carrier complex, or the drug forms a complex with the carriers, and it avoids the removal metabolism. In the previous slide we have seen it works. One method was by it's avoiding the first pass metabolism. Second, it avoids the normal metabolism. It avoids bypasses the excretion, opsonization, and the phagocytosis. So what are the various methods for removal of the drug from the body? So this carriers overcome this removal or this elimination mechanisms, thereby it is present in large quantity in our body. Secondly, in the diseased tissue, as per the physiology of the diseased tissue, they are having loose fenestrations, that the cells might be very loose, poorly lymphatic drainage system, and the last one is enhanced permeability and retention. So this is another one of the major condition of the diseased tissue, that they are having enhanced permeability. That is, the permeability is enhanced. What is the reason for enhanced permeability? The above said reason, that is the loose fenestrations and the retention time. So at this stage, at this diseased tissue, this diseased tissues can hold the drug molecules for a longer period of time. So it enhances a large quantity into the cells, and it remains for a longer period of time. Next, the size and surface properties of the drug delivery nanoparticles. If it is a nanoparticle, that nanoparticle, or if it is some other carriers, that carriers. So this carriers has the surface property of this carriers has, it avoid the uptake by the reticular endothelial system, that is RES. So it overcome the uptake by the RES, and it remains in the blood circulation for a longer period of time. Now to attain this, to attain the to avoid the uptake by the RES, the size of the carrier should be less than 100 nanometer in diameter, and the surface should be hydrophilic to circumvent the clearance by the macrophages. So if the particle size of the carrier is less than 100 nanometer, and if the drug is hydrophilic in nature, it avoids or it overcomes the clearance by the reticular endothelial system. So now I hope it's clear for you very well how the carriers helps in targeting. So this is a demography of the normal cells as well as the diseased cells. We can see the cell membrane, or the cell membrane around the cell membrane, or if it is a capillary wall also. In the normal cells where the picture is A, here the walls are strong enough. The walls are strong enough, and it is not permeating the nanomedicines or any sort of medicines. But in the case of a diseased condition, the membranes are weaker, with looser fenestrations, and it is permeating the medicines into the intracellular part. So that is, in this way, our drug carrier complex targets the systems, and it remains in the system for a longer period of time. Okay, so that's it for this session. So I hope you are clear how the concept of the targeted drug delivery systems works. What is the need of targeted drug delivery system? What are the types of targeted drug delivery system? How the carrier should be? Characteristics of the carrier, characteristics of a targeted drug delivery system, etc. Okay, so thank you, one and all. Bye.